Hello, everyone. Welcome to the first official Midwife Calling podcast. My name is Robin Comfort, and this is, of course, Faith Gibson. And Faith, I think we should just start with talking a little bit more about who you are. Where did it all begin for you?
Well, let me give you just a tiny little bit of background,
Yes,
which
please.
is always helpful to kind of know a little bit about somebody. I was a wife, wife and mother. Now I'm a widow and a mother, but three grown children, two grandsons, a godson, and let's see, what am I supposed to say next? Oh, my family. I'm from a historically Mennonite family on one side and a Quaker family on the other side.
Okay.
I live in a Judeo-Christian household, so we're surrounded by all the different characteristics of religion, some of which are very helpful and some of which sometimes are, you got to wonder about them, whether or not it helps.
Okay.
In terms of my interest in childbearing, I have to say that was a hot topic when I was in 5th grade. This was before they did any kind of sex education in grade school.
Okay.
And my parents, nothing was forthcoming from my parents about anything biological.
Sounds familiar. Yeah.
Going to the bathroom was a big mystery in our house,
Sure.
like, in fact, I used to think that the big secret that because my parents were always fully clothed under all circumstances, and the big secret was that if you had, opened my dad's shirt, you'd have seen blue sky through there or something, they didn't have bodies, that kind of thing. My girlfriends and I, we kept thinking about, like, this in the first place, we thought maybe the information was wrong.
Sure.
The idea that the baby came out of, down there was just crazy, like surely the stork really did, drop them down in little baskets.
Yeah.
And so, but we talked endlessly about how did that great big thing get out of that little tiny place. And of course, I finally went to nursing school and I found out how it happened.
The aha moment.
However, the odd thing is that nursing school includes what they call a clinical rotation, where you are actually in the hospital and you're doing in different wards. Right. And one of my very first places to have been put for 2 weeks was surgery, the surgery department.
Oh, okay.
So the first baby that I saw was born by cesarean section.
Wow. And
I was flabbergasted that the baby came out perfect. The surgeon reached in and this completely formed, cute little baby girl came out, cried, wiggled, all that kind of thing, dried her off and handed her, to somebody else to take care of. But I didn't know exactly what I thought, but somehow or another in my mind, the idea that the baby would come out and they would take it to the nursery and they would kind of, fluff it up for a while.
Exactly what I was thinking.
And after a few days, it would look cute, and then they would show it to the family.
Yeah.
So of course that was crazy and not the case at all. My first vaginal birth was as a student was entirely different in that. It was a young woman at that time. They were described as unwed mothers. It was not unusual for a family to literally drop a pregnant daughter off at the front door of the hospital and speed off.
Wow.
And this was one of those births.
Okay.
And she had, she was obviously ready to have her baby when she hit the door of the labor and delivery room. We kind of, helped to get her out of her clothes really quickly and into a gown down the hallway to the delivery room.
Okay.
And put her on the table. And the anesthesiologist came around from at that time, our labor and delivery rooms were like the ORs on MASH. If you've ever seen the television series MASH, you know, where they have all of these operating rooms all together in one huge room with screens between them. It was like that, only there were actually only two tables on the two sides of the room. And this nurse anesthetist came around, and she comes down with the mask like this, the general anesthesia mask. But you know, the mother is she's laying on a stretcher with her head towards this end of the room, and the anesthesiologist or nurse anesthetist came around in a way that she couldn't see her there. She didn't know she was there until this black thing came over her mouth, and she starts going, "Oh no, no, no!" And about that time, the resident walked in. We had paged the resident, and he came in, and he says, never mind, you know, don't bother. She'll know better next time. And that was, you know, that was the idea that childbirth hurts so bad that you couldn't possibly stand it without without general anesthesia. So that, you know, that started a whole train of thought in my mind, and I won't go into it right now, but another time we'll talk about the 5 north and 1 south, the white mothers on 5 north and the black mothers on 1 south, and the dramatic difference between these two classifications. The only difference being skin color, but the way that they were treated was entirely different, and their births were entirely different. But
this was in the South, right?
Yeah, our hospital was still officially segregated at that point. It desegregated while I was still a labor and delivery room nurse. So actually, the shorter part, I was a nurse right at the very end of segregation and the very beginning of desegregation, which is a really kind of an interesting contrast to see both side by side and in a short period of time and in the same place, same people, same hospital, same everything, except segregated versus desegregated.
You were privy to this huge transition. That is incredible. Or right, in theory, right?
Well, I thought about it as at a later time in my life, not in the middle of actually living through it, but I thought about it as the most extraordinary double-blind study, so to speak, or at least prospective study, because we got to see what happens when you massively medicalize normal childbirth, and when you deal with childbirth in a way that your motives are definitely unpure. In other words, the motives where we don't do anything for our black mothers. We just let them labor, and then when they start to push, we catch the baby, kind of thing. Like we don't provide them what you and I would think of as midwifery care, and we certainly don't provide them with any drugs or anesthesia or any of those things that we do for white women. And so, to see the difference between those two ways of dealing with childbirth, and to see the different outcomes, the fact that when you give massive amounts of narcotics to women, and then you give them general anesthesia, and then you drag their baby out with forceps, are we surprised that drugged baby, if you drug the mother, you've drugged the baby, are we surprised that the drugged baby doesn't breathe?
Yeah, has some trouble.
Which is something of a problem, since how you've been pregnant for 9 months with this kid, and you want, you would like to, you want to go home with a baby, as opposed to with a story about how, the baby died. So fortunately, not that many babies actually died, but a lot of our babies had to be resuscitated. And, I always wonder, like, how many brain cells did we kill off in the process of having them not breathe for some, sometimes it would take 5 or even 10 minutes before they were really able to be well oxygenated. The good news is that the system of being pregnant, when the baby is a fetus rather than a newborn, is one in which the hemoglobin in the fetal blood is much more saturated than it is when it becomes an already born baby. so that the baby kind of comes with, it's a little bit like carrying a little oxygen tank with it.
How handy.
It is. It's really, Mother Nature is incredibly smart, and clever and persistent. In spite of everything you throw at her, she
right.
she manages to figure out how to make it work. And so the babies actually, they really do have more hemoglobin in their red blood cells than they will have within just, I don't know how many hours, but within a few hours of birth.
Okay.
So I'm hoping that those babies were okay in spite of all of the really, terrible things we did to them. But anyway, so look at my list there and see where we go next.
Yeah. So we'd love to hear more about, so where is this, you've mentioned seeing your first birth as a cesarean birth, and is this the whole picture as an early nursing days where your interest in childbirth came from?
No, I think that my early interest in childbirth, in the first off, as I described earlier, it had to do with how the hell does that great big thing get out of that little tiny place?
Sure. Yeah.
And then having actually seen that happen, the young mother that I was talking about earlier, the 16-year-old, in spite of this, this kind of, I don't know what to call it, but a kind of negative conversation between the nurse anesthetist and the resident.
Yeah.
That baby just slipped out.
Wow.
I mean, she pushed and the baby came out. In other words, she was not anesthetized. The resident said, no, don't do that anymore. And God knows he didn't do anything because he was busy putting his gloves on still, getting, all that kind of stuff. And the baby just slipped out. And I thought, wait a minute, where is this hurts so bad you can't stand it, you have to have general anesthesia? Those two pictures side by side like that just didn't match. Like, I went home thinking there's got to be more to the story there, than what are the story behind those two things? Why did the nurse anesthetist say what she said? Why did the resident say what he said? She'll know better next time. Like we're gonna let her have this horrible experience because that'll teach her, she'll know better next time. And then she just pushes this baby out without any undue effort. It wasn't one of those long, I mean, you and I have been at births where pushing the baby out is a little bit out and a little bit in and a little more out and a little in, and this goes on for quite a while. You could go out for dinner and come back and we're still looking at 50 cents worth of Kappa, hoping that we're gonna that the baby's gonna be born vaginally. We don't have to do anything kinky, like go to the hospital or if we're already at the hospital, for them to decide, to either use a vacuum extractor or cut a big episiotomy or do a C-section or something like that. So it's always gratifying. Personally, I think of it as gratifying to see a mother just push her baby out without too much preamble, too much of a prolonged kind of, little teeny tiny centimeter at a time kind of thing. So I really appreciated that. And that certainly was what I saw in Black mothers on a regular basis. And what I saw with white mothers, because they were profoundly unconscious, was that they couldn't effectively push their babies out, which is why forceps were used.
I see.
So that's really quite a difference. We'll tell this story fuller in another iteration, but those Black mothers that precipitated in the elevator, we flip the switch off and the baby would come out and you'd hand the baby up to the mom and she'd say, oh, look what I did, and she'd be, all over the, all the, I'm so happy and it's such a pretty baby. And, you know, when you're under general anesthesia and you give birth, none of that happens.
Right.
You are not there.
Yeah.
You're the one person who didn't come to your birth.
Totally different.
Didn't get to take any credit for it.
Mm-hmm.
It's not, look what I did. Mm-hmm. It's, you know, and I heard this 100,000, well, maybe not really 100,000 times, but it seems certainly thousands of times, in which these anesthetized mothers, as they came, you know, back into consciousness, and eventually their doctor, you know, the doctor would show up and the nurse would show up with the, you know, with the new baby, and they would thank the doctor for, you know, oh, thank you, doctor, for delivering my baby, you know, and, you know, I just was speechless then. I'm speechless now, because that was the mother who, even though the doctor pulled the baby out with forceps, it wasn't because she couldn't push a baby out. Mm-hmm. It's that they drugged her. And under the influence of those drugs and the anesthesia, it's, unless you're high parity, if you're having a fifth baby, you know, sometimes women would deliver no matter how many, you know, how unconscious they were, their uterus would just flip the, you know, shove the baby down and the baby would be out and that'd be it, you know. And often it was before the doctor got there, which is to say then the nurses were in big, you know, what I call deep yogurt. Because, see, the thing is that because childbirth is a surgical procedure, it is billed as a surgical procedure. This is still true today. It's been true since 1930. Mm-hmm. When the AMA originally had a meeting at which there were two doctors present, one a surgeon, one an internist or family practice physician, and they went through all of the things that, you know, all of the quote procedures, all the treatments that are done. And when this surgeon came to childbirth, he said, oh, that's a surgical procedure. And ever after. So you can't bill for a surgical procedure unless you are in the room when it happens.
Aha.
So the reason why obstetricians have to be in the room when the baby's born is, of course, that they can't bill for a surgical service without being present, at least present. Right. No one really knows whether or not they did anything that one would call surgical, but you can't be in the parking lot or down the hall without risking the possibility of that being considered a fraudulent billing. Mm-hmm. So doctors don't do that. They're pretty scrupulous about that. I keep coming back to that video that both of us watched, talking about that the reason for the quick cutting of the cord is to separate the mother from the baby, because they're two different NICU staff is different than the labor and delivery room staff, that kind of thing.
So what happened to get you interested in midwifery as a completely new route in your life?
Well, the first thing I'd have to say is that I left nursing under circumstances in which I kept getting fired or basically for doing really what I would call the ethical thing, but not necessarily following the, you know, the very specific protocols of a particular doctor. And, you know, I just, by the time I got fired, I guess it was the third time, I said, that's it, I'm out of here. I never want to see another pregnant woman as long as I live.
That didn't last very long, did it, Faith?
Well, it lasted for, actually, so what I wound up doing is I joined a domestic Peace Corps project, which is a domestic version of the Peace Corps that is called Vista. They're called Vista Volunteers. Okay. And I was stationed in a very small farming, cotton growing also segregated farming community in North Carolina. And I spent a year there, and I had wonderful experiences, which I'd be delighted to talk about another time. One of the things that I used to do was there was a very, very elderly Black woman, and her daughter, Maggie Nichols, was 100 years old, and her daughter was, they thought, around 70, but nobody could remember when she was born. Okay. So they didn't have there were no records of her birth, and nobody could actually remember. But she would talk about the stories that her dad told her about the days of slavery.
Mhm.
And one of the things that I remember the most was that Maggie Nichols did a really fantastically wonderful job of actually being able to recite what her dad said the way he said it,
Wow.
which was to say, what she described was the two of them were talking. She was about 7, 8, 9 years old, something like that, and her dad said, "When I was born," let's see how this goes. You have to cut this part here. Um, oh, "When I was born, we was all slaves, but when you come along, we was free people."
Mm.
And she did that. We was free people in a way that you could just tell that that was exactly what her dad had said,
Yeah.
you know. And I felt really privileged to have, like, if you're really blessed to actually have history be handed to you directly,
Mhm.
so that you really get it from the person who lived it rather than someone who told someone who told somebody who told you about it, that kind of thing. So I was really I just thought that was an amazing experience, and I have always remembered Maggie Nichols, who she was 101 years old in 1976, so I'm sure that she is long gone now, but I hope she is really happy and in the hereafter.
Yeah. Yeah.
um, so anyway, so I left North Carolina and drove cross country to San Francisco
By yourself?
because I had two of my three children. My two daughters went with me at that time. My husband and I were separated, and my son was living with his dad, and I had the two girls.
Okay.
And so we wound up in a little teeny tiny apartment, five of us, in a little teeny tiny walk up, one bedroom kind of. Well, actually, it wasn't even one bedroom. It was, I think they call it a studio. Some of the kids slept in the dining room and the adults slept in the living room,
Sure. Yeah,
that
you
kind
make
of
it work.
thing, only in San Francisco.
Yeah.
And I've never exactly remembered how this happened, but somehow or another, I found out that Elizabeth Davis was living. We were living on Third Street, Geary and Third Street, and she was living at 9th Street in
Okay.
Geary.
Uh-huh.
And I don't remember how we got together, but we did. And then through her, I got introduced to Suzanne Arms, and then Suzanne and I wound up driving to Sacramento, because that was the beginning of the trying to get a midwifery licensing law passed.
Ah.
That there had been a case against a midwife in Santa Cruz, Kate Boland, which had gone badly for midwives.
Mhm.
Uh, Again, I'd like to tell this story fuller another time, but I won't go into the details right now.
Definitely.
In which there was a an undercover sting against the three midwives that owned and were running what was called the Santa Cruz Women's Collective, and they set the midwives up
Wow.
for them to swoop down in the middle of the night and arrest them. There was an undercover agent who introduced herself as Tracy Johnson. I can't remember her name now. But in any case, that she called in the middle of the night and said she was in premature labor and would they come to the house? And Kate Boland said, "We don't do, you're only 7 months pregnant. We don't deliver premature babies at home. You have to go to the hospital." And she said, "Well, maybe I'm not really in labor. Can you just come check me? And then if I'm in labor, I'll go to the hospital, no problem. But if you just come check me." So the midwives, I've never quite understood why all three of the midwives came, but they did. This was at a time when, going to a birth was a big, it's like uh, just everybody wanted to go to a birth, like that kind of thing. So all three of the midwives showed up, and then it turns out that I think there were 6 police officers, and there were another half a dozen undercover agents from the medical board who were hiding in the bathrooms and the bedrooms and all that kind of stuff. And they arrested Kate and the other two. Linda Bennett was one of the other 2 midwives. I don't remember the third one. But that created a case that went to the California Supreme Court, that even though the Medical Practice Act itself never makes midwifery, there's nothing in the law, in the legislation, for licensing for the practice of medicine or any other profession that criminalizes the practice of midwifery, but the medical board wanted to get a ruling by the Supreme Court, the California Supreme Court, that would make that an illegal practice of medicine. And the Kate Boland case did exactly that. Wow. So what that meant was it set midwives up for being arrested. And so we were trying to get a midwifery licensing law passed, which went on for a very long time, from 1976 to 1993. So we'll tell that other story. The 1993 story comes later. But anyway, so I started working with a midwife in Palo Alto whose name was Donna Driscoll, and she and Heather Damari had been lay midwives since the 1975-ish, something like that. She had attended about 500 births at this time, and she was really truly the best midwife that I have ever worked with. I was so pleased to work with Donna. I wanted to suck out as much information as I could, but she had a knack of sorts for, or an intuition, I'm not sure what to call it, for really understanding not just what you could see on the surface, but the structures beneath it, how something, when this happened, this other thing would happen, and then it would, and then this third thing would happen, and there was history behind it. And if you didn't understand the history behind it, you wouldn't really understand what you were seeing. And she was so good at that. And unfortunately, she died in 2008. She was a victim of the lack of health insurance. That she had a not fatal disease that required medication that she was having a really hard time getting because she didn't have health insurance, and she kept going to emergency rooms trying to get the drugs that she needed. And as she put it, that all the doctors who worked there were only 15 years old, which is they obviously were, they were out of medical school, so they were maybe 27 years old, something like that. But
sounds tragic.
But the kind of doctors that get hired in emergency rooms way in Humboldt County, these little teeny tiny places, the postage stamp emergency rooms, are really people with very little experience in the practice of medicine. They just got out of school and they are legally authorized to practice medicine, but they have a very little depth to their understanding. And they couldn't figure out how to give her the right, a prescription for the drugs that she needed.
Wow.
And so it killed her. So anyway, so I always think of myself as as sort of carrying her legacy forward. That I teach and preach for both of us, so to speak.
Sure.
And one of the other things about Donna that I found to be different, she was the very first midwife that I had ever met. So I kind of thought that all midwives were like Donna Driscoll, but that wasn't true. And what that really big difference was, that Donna was really, she was what you would call really founded in the science of midwifery in a way that a lot of other lay midwives were not. They, that I still hear this from time to time, although not nearly so often now that, that we're now 25 years down the road from the beginning of midwifery licensing. But the idea that somehow or another, that the body just knows what to do, that you don't have to worry, the body knows what to do. Well, if you hang around a body long enough, they all die. So the idea that, that the body will always do the right thing without, that all interventions are interference is not true. And so that was the big difference that I found with Donna.
Stay tuned for part 2 of this episode of the Midwife Calling Podcast. Until next time. Oh, and I must say, if you made it to the end of episode 1, it was released on, or maybe around, Faith's birthday. Happy birthday, Faith.